Today we're going to talk about coronary artery disease or ischemic heart disease, as it's the number one killer of Australians. So the risk factors is hypertension or high blood pressure. Over time, this extra pressure puts damage on the arteries and can damage the walls. This damage leads to plaque buildup, which is from fatty substances of fibrin, calcium, and waste products. Plaque can break off and platelets can stick to the damaged areas, which can further ischemia. When the plaque builds up in the arteries, it causes them to narrow. This is called atherosclerosis. The risk factors are smoking, high cholesterol, high blood pressure or hypertension, and diabetes mellitus. So when the blood flow is interrupted to the heart, there's poor perfusion to the heart muscle itself, delivery of blood, oxygen, and nutrients. This can lead to angina, which is chest pain due to myocardial ischemia, resulting from atherosclerosis. The poor perfusion can also lead to myocardial infarction, which is damage or death to the heart muscle, depending on the severity. As a result of all this, the heart works harder to compensate and tries to have a higher cardiac output from the damage to the myocardial infarction, atherosclerosis, and hypertension. The heart can become enlarged, hypertrophic, and eventually lead to heart failure, where the heart cannot meet the demands of the body. There's less exercise tolerance due to fatigue because of lowered percentage of blood leaving the heart, and the ejection fraction can be under 40%, with normal ejection fractions being over 55%. Two types of heart failure: left-sided and right-sided. So left-sided or systolic heart failure, the symptoms are higher respiratory rate, work of breathing, patients can be short of breath, can lead to fluid building up in the lungs, which is called pulmonary edema. With right-sided heart failure or right ventricular failure, the pressure of the left-sided heart failure causes right-sided heart failure, and the fluid backs up in the veins, causing peripheral edema and ascites, which is fluid in the abdomen.